measurement-based intervention to target, which is the third ingredient identified by the authors. So they elaborate on this as a member of the team, likely a school-based staff, is designated as a primary point of contact to regularly check in with the student. So whether that's a guidance counselor, social worker, I suppose even, potentially even a teacher, but there is a primary point of contact established so that someone is checking in with that student, perhaps even on a daily basis. Validated measures utilized to formulate diagnostics plan and progress against plan, referring for formal assessments, health, education, or welfare-based as needed. So, and having, kind of a formal process when someone has not just in the screening, but okay, if they, then let's follow standard and best practices for creating a diagnostic plan, which may not necessarily mean kind of DSM diagnostics necessarily, although those diagnostics may be key to not just for identifying the health needs, the behavioral health needs of the student, but also obtaining resources based on diagnostic qualification or qualification based on diagnosis. So doing good diagnostics in a school setting can be really important, and from an advocacy standpoint as well as a clinical. And making sure we have a plan, right? Let's set goals in collaboration with the student and the team, and let's make sure we're regularly checking in on the progress to goals. Just good social work practice, and making sure that that we're referring to these, outside resources as needed, and also tracking when, where, and outcomes of those referrals. Utilizing predetermined progress to, that's kind of awkwardly worded, but essentially making sure that they're not just checking in when something goes wrong, right? That in this plan, part of this plan includes regular check-ins, somewhat like an IEP, but perhaps more formal and organized and maybe more frequent. But in other words, we don't just pay attention to that student when they're acting out or decompensating in some way, okay? Likewise, for full collaborative case team reviews, those should be pre-scheduled. The intervals should be kind of decided at a program level, and can be certainly tiered to the needs. So you could take those tier 2 and 3, and maybe the frequency of those reviews can be tiered to intensity of need as well. And making sure that we're updating a plan. So and we're acknowledging if a student is responding well to interventions, that we're accounting for that. Obviously to make sure that the student is acknowledged for their participation in it, but also making sure that the plan reflects their changing needs, that may be changing needs in a positive way.